Hello friends, I am Dr. Dattaram. I am a consultant surgical gastroenterologist and a laparoscopic surgeon practicing in KIMS Hospital, Gachibowli, Hyderabad. So laparoscopic inguinal hernia repair. This is a very common operation what we do in our practice. So laparoscopy is having many advantages compared to open surgery for an inguinal hernia. So the main things are the pain. Pain after surgery is very minimal because the cuts what we make in laparoscopy are very small and the trauma of access is very less. Second thing is the wound is not there. So the wound related problems are very minimal in laparoscopy. So because of these advantages, the hospital stay is very short. The recovery is very fast. So most of the patients are admitted on the day of surgery and discharged the very next day after the operation. So many patients, they have literally no pain. So they can resume their office and other day-to-day activities within 3 to 4 days after the surgery, because by the time most of the pain will subside. Even technically, the recurrence chance of a laparoscopic operation is much less than the open surgery in the long term. So in laparoscopy, the entire myopectoral orifice is covered by the large mesh. All the potential spaces of a hernia are all covered by the mesh. So this is the extra advantage the patient gets by doing a laparoscopic surgery. If the patient has a bilateral inguinal hernia, the hernia on both sides, so laparoscopy is the best option, because to the same small wounds, both the sides hernia repair can be done. So laparoscopic inguinal hernia repair scores over open surgery because of the many advantages it has to the patient, both in the short term as well as the long term.